comorbidities can be everything. For those gray diagnoses that are very easy to go any way, like CHF and those type of diagnoses, comorbidities, age, and all the related factors that increase a patient's risk change the whole picture. Even with things like UTI, it just makes a huge difference. Those things are not a cut and dry inpatient, and you may have a patient that doesn't have such a critical, variance in whatever their normal status of health is, but because of all those comorbidities that they may have and the increased risk, they could very quickly decompensate, or if you don't take care of them sooner than maybe a more healthy overall person, they're just much more at risk. And that can be the difference between getting an approval or denial or winning an appeal. We can make that case ourselves in our reviews as far as giving attention to comorbidities and other things going on with the patient, but to have actual criteria available that gives you kind of an official way to acknowledge that is invaluable, honestly, and it's been a real help to both sides of my team with utilization review and denials, because it just gives you more structure. I mean, one of the main things about MCG that makes them stand out is there are a lot of parts of the criteria and their products that are there to help you with your documentation, not just for you to check a box, but to give you ways and know what you should look for and know what you should document. And that can be really helpful, especially for some, newer frontline utilization review nurses that have just recently came into that role. They know what makes a patient sick, but they just quite don't know what things to emphasize and when, and having that to go by, like I say, the multiple condition management criteria especially, but even other things like extended stay, the extended stay portions of stuff, it really tells you, what can make a difference, and it helps educate your team too, because it points those things out when they're working with those criteria on a daily basis. That helps them remember and learn, okay, these are the things I need to keep an eye out for. I'm not just going to brush off a case because it didn't check this one box. If I know there are other issues, I've got another avenue for putting those things together and making a point that can be beneficial.